So let's talk about variceal bleeding. How do you manage it? Variceal bleeding obviously needs patient's resuscitation, so ABCs are the main thing. But then medication specifically for that, again, PPIs are not used for it. We use terdepressine, that's the only vasoactive agent that's approved for it, number one. Number two, all the patients need to undergo endoscopy. But prior to endoscopy, they need terdepressine and they also need antibiotic because that reduces mortality. The antibiotic preferred are fluoroquinolone, so ciprofloxacin, moxifloxacin, that class of medications. Once they undergo endoscopy, they need to undergo endoscopic variceal band ligation, and that is the main line of treatment. If bleeding is uncontrolled, then we use the Steng-Stacken Blackmore tube, and for refractory cases we use the TIPS procedure, that is transjugular intrahepatic portosystemic shunt. But to prevent this from happening prophylactically, we can obviously, the main drug is propranolol, but then we can also do endoscopic variceal ligation for medium to large esophageal varices as recommended by NICE, and even we can do the TIPS procedure for them. In terms of resuscitation, obviously ABCs, blood transfusion if needed, correct the clotting factor, so we can use FFP, vitamin K, and platelet transfusions. We've discussed platelet transfusion, that if platelets are less than 50 and active bleeding is there, we need platelet transfusion. If INR or APTT is more than 1.5 times, then we use the other agents such as FFP.